Very simply, kidney stones are mineral deposits or debris that form into rocks or stones within the kidney. Well, kidney stones usually form due to forms of dehydration or lack of fluid intake. It's sort of like at the beach. The less water you put in the pail, the more sand collects at the bottom of the pail. So hydration is very important. Other reasons can include metabolic problems or dietary. It can also occur with certain medications that people take for chronic diseases. Well, usually the presenting sign of kidney stones can either be pain, infection, or blood in the urine. The problem with stones is they're very irritating to the system, and what they do is they can actually block the flow of urine out of the kidney. That blockage is what causes the pain. That's what also can cause the infection and also can cause the blood in the urine. So the biggest problem that people will present with is the pain as the first sign. So the first thing we do when we discuss treatment is to determine the location of the stone, and pretty much the second thing we do is determine the size of the stone. Those are the two critical points to discuss as to how next to approach the stone. So the two ways that we typically treat stones in this country are either with external shockwave lithotripsy, which is non-invasive, which are pressure waves that are placed against the back to break up the stone. That is done under anesthesia, but it is done as an outpatient. If the stone has dropped down the tube that drains the kidney, called the ureter, and it's smaller in size, we can actually retrieve the stone with a telescope called the ureteroscope. That telescope can go up the ureter, we can grab the stone and pull it out and send you home the same day. Another procedure that I would like to talk to you about is a specialized procedure called percutaneous stone extraction. When the stones are too large to extract by the other means, we will take a patient and enter the flank or the back through a very tiny incision. Through this tiny incision, we insert small instruments, grind up the stone, and then extract the stone. This now allows us to remove the total stone burden and send the patient home the next day.